Today's requirements regarding ergonomics and efficiency determine the operational procedure in the ENT practice. It is not unusual for 80 to 100 patients to be treated each day using an Atmos S61 servant. The extent of diagnostics and therapy services performed on the ENT treatment module may be very different. Today's ENT practices demand flexibility with their equipment needs and can benefit from the modularity of the Atmos S61 servant. For the patients, comfortable ergonomics begin the moment they sit down. The doctor works efficiently without walking around the patient, who is quickly and easily brought into the perfect position for precision treatment. High-quality examination microscopes are used on the Atmos S61 servant. An efficient instrument management system enables the immediate examination or treatment of the patient without having to wait or change rooms, and reduces the need for extra personnel. Besides the use of mirrors and counter-mirror lamps, endoscopy has asserted itself over the past few years. Today, endoscopic examinations of the paranasal sinuses, the pharynx and larynx are standard. Following necessary hygiene guidelines, an ideal arrangement of endoscopes, mirrors, instruments and consumables are placed within a well-thought-out instrument management system that can be individually adapted to the various practice workflows. The conception of the treatment unit began with hygiene. Separation of the clean and dirty areas is most important. Instrument and endoscope management with disinfectant monitoring are two of the system's key features. Sprayers powered by air from an internal compressed air system are used for a quick administration of medication. The suction of secretion and blood are standard applications in ENT outpatient departments. Automatic light barriers, simple cleaning mechanisms and an easily removable suction device are each reliable functions that the treating doctor has at his disposal. By connecting a Politzer olive to the compressed air handle, a quick application of the Politzer maneuver is possible. Here the air goes through the tube into the middle ear. Coagulation methods using the radiofrequency surgery device Atmos RS-221 can be integrated into the Atmos S61 servant. One of the most urgent tasks to be performed in the ENT outpatient department is to stop a nosebleed, the so-called epistaxis, which is the most frequent medical emergency. A quick cleaning of the outer ear is possible with the ear irrigation module Hygrotherm. The warmed water, which is heated to body temperature and suctioned automatically, is activated by removing the irrigation handle from its holder. The handle allows for exact metering for the amount of water used and the water pressure. Optimum integration of various functions in the treatment unit allows the treating doctor to continue further diagnosis at the Atmos S61 Servant workstation. Video archiving has established itself as a valuable tool for record keeping. In addition to improving patient diagnosis and quality control by documenting the treatment process, video examination and archiving offer better accounting possibilities with the funding agencies. For the reliable diagnosis of the larynx and vocal cords, a stroboscopy examination is necessary. Atmos's innovative LED technology has enabled successful integration of video stroboscopy directly into the operating interface of the Atmos S61 Servant Vision module. The image of the mucosal wave does not require any extra time or preparation in comparison to an ordinary endoscopic larynx examination. By removing the laryngoscope and the light source, the Atmos camera and stroboscope are automatically ready for use. Additional examinations or having to move from one examination room to another is no longer required. The innovative Atmos LS21 LED light source is distinguished by its high-performance white light LED and its almost unlimited service life. The light source is connected directly to the endoscope, thus eliminating the need for expensive and sensitive light conducting cables. The Atmos S61 Servant Vision module sets new standards in the ENT workplace with regard to professional visualization. It offers optimal and modular functions one expects from a modern endoscopic workstation. Light modules with conventional cold light technology, as well as innovative LED technology. Besides the ear irrigation, where the outer ear is rinsed with water at body temperature, the ear irrigation module of the Atmos S61 Servant is used for nystagmus stimulation during the examination of the vestibular organ. However, here the water temperatures vary differently from the body temperature. The examination of the nystagmus reflexes, with the help of the nystagmus binoculars, is easy to monitor and record. The new Atmos S61 Servant. The ideal solution from Atmos, consisting of Atmos S61 Servant ENT workstation, Atmos S61 Servant Vision, Atmos S61 Servant Instruments, Atmos S61 Servant Therapy, Atmos S61 Servant System. The purchase of an ENT treatment unit is a long-term investment. The Atmos S61 Servant's modular design allows the practitioner to add on components as needs change or as the practice grows. All modules can be added on-site by one of the Atmos service technicians. This way your Atmos S61 Servant can later be upgraded when you decide to increase your range of services. The complete technology is housed in an appealing, professionally designed cabinet. All of the important functions and handles are ideally accessible for a highly efficient and comfortable working environment. Patients and doctors alike believe the ergonomic and modular design of the Atmos S61 Servant are comfortable, reliable and more efficient. These advantages save time and money and provide a positive return on investment.